Hypertension, known as the silent killer, is at an all-time high. In fact, hypertension is one of the most common reasons for premature deaths all over the world.
In fact, the 2012 WHO data shows that 1 in 4 adults in India suffer from hypertension. In fact, Samir, I think it can also be deemed as an epidemic.
You're absolutely right. In fact, hypertension, if not treated appropriately, can increase the risk of stroke, heart disease, eye problems, kidney problems, and a whole host of other issues.
And that is why today on Doctors on Call, let us look into how we can manage hypertension. I'm Dr. Sonalal Gupta.
And I'm Dr. Samir Gupta, and welcome to Doctors on Call. Blood pressure is the force of blood against your artery wall as it circulates through your body. Blood pressure normally rises and falls throughout the day, depending upon the activity we are doing. But when it stays high consistently, it starts affecting our health. A normal blood pressure should be around 120 by 80 millimeters of mercury. You can have high blood pressure for years without any symptoms. Even without any symptoms, damage to your blood vessel and your heart continues. For most adults, there is no identifiable cause of high blood pressure. But some common risk factors are being overweight, smoking, having a family history of high blood pressure, and chronic conditions such as diabetes, kidney problems, and sleep apnea.
Now let us see what some of the doctors in the community have to say about high blood pressure.
The complications like heart disease, kidney failure, problems related with the foot including the gangrene of the foot, problems of the eyes like retinopathy, problems of the nervous system and brain including the stroke, all of these complications are preventable to a large extent by what we call as the A, B, C, D, E of diabetes. Here A stands for the HbA1c or hemoglobin A1c, and the target is to keep it between 6.5 and 7. B stands for the blood pressure, which should be normal. C is for the cholesterol or the lipid profile, and here the bad cholesterol, which is LDL, should be below 100. D is for the drugs and the diet, and in the drugs, after your oral anti-diabetic drugs or insulin, you should always take the statins, which are going to prevent your cardiac problems. Similarly, in the diet, one should take good quality and quantity of all the essential nutrients, fibers, minerals, vitamins from the natural sources.
In the short, tips for avoiding complication in diabetic subjects are: 1. A regular walk 45 minutes per day, inclusive of all 7 days. Quit smoking. Healthy diet. Keeping A1C less than 7%. Blood pressure less than 140 by 80 millimeter of mercury, LDL cholesterol less than 100, HDL cholesterol more than 40 in male and more than 50 in females, blood pressure less than 140 by 80 millimeter of mercury, urine examination for albumin yearly, a regular dilated fundus examination yearly, and daily inspection of the foot for development of any ulcer, cracks, and fissure. In case if you develop any ulcer, you must report to your physician immediately.
Please remember one thing, that there's a common misconception that we find in our practice, that once you get on blood pressure medications, you will never get off it. That's absolutely not true.
I think I couldn't agree with that more. But it's important that if you have hypertension or high blood pressure, do take your medicines regularly. Adopt a healthy lifestyle and diet, because that is very, very important, and it goes a long way.
And once you follow those guidelines to actually be healthy, you might actually get off your medications as well. Take care. See you next week.